Hi, I'm Dr. Daniel.
And I'm Dr. Josiah Hackney, and we own Hackney Chiropractic in Edmond, Oklahoma. We're both Webster certified chiropractors. So the Webster technique is additional training that chiropractors can receive after graduation. We both went through the training. It's 16 hours of not just learning what to look for as far as adjustments in pregnancy. We work with the pelvis, we work with the soft tissues, so the muscles and the ligaments in that area. But the education is also about birth in general, what that process looks like, how we can support moms and families outside of just making an adjustment to their sacrum.
Yeah. Well, and then a couple weekends ago we went to the advanced Webster training too, which is another 16 hours for even more in-depth analysis of the pelvis and what we can do to help support the pregnant moms.
Yeah,
They're really perinatal, so we got the during pregnancy and then postpartum as well.
There's more newer research coming out as far as what to look for and how to support moms, and even things that could be indicators of whether they are a good candidate for a vaginal birth after cesarean. Lots of exciting things that we're starting to implement in our practice.
Yeah.
So when we started our practice, we were very open to anyone that had a spine.
If you have a spine, you need an adjustment.
We can check you out. But seeing moms, taking care of moms was kind of my thing. So I was Webster certified first, and then I got pregnant, and I told Daniel that either he needs to get Webster certified or I'm going to go to another chiropractor who is, and
which I thought was ridiculous.
that's awkward.
But,
so he went to the training, and he came back from that from the 16 hours and changed. He was just like, we have to take care of all pregnant women.
And the biggest thing is I understood why she didn't want me to adjust her without that training. I didn't understand before, and then after going to Dr. Geniome's Webster training class, I'm like, okay, I get it. I understand now why you didn't want me to adjust you before.
There are a lot of changes to the biomechanics of the body during pregnancy.
Yeah.
So
having a fuller understanding of that makes a big difference.
Yes. So I was out and with our baby, and he took over seeing the moms, and then I came back with more of an emphasis on babies and moms after birth, because there are a lot of changes that happen in pregnancy, but so many that happen postpartum, physically, emotionally, and so it was, my heart was, after I experienced that, I need to take care and be that support for moms during that postpartum period. So I see moms postpartum and their babies, and then Dr. Daniel sees them pretty much all moms in pregnancy.
Yeah. So a lot of times we get moms that come in and they say, well, I have the normal low back pain during pregnancy. And I would say things that are common, there may be, pressure is normal, but pain is not normal. So if there's low back pain or sciatica or rib pain or, there's a lot of different aches and pains that the moms will come in for, kind of starting with care. And then we just talk about, my biggest thing that I can do is to help to balance the pelvis, working our way up the spine, just so that the body works better and it functions better. And when it functions better, then it feels better. And then we can kind of see like what is actually normal, because if we remove the biomechanical imbalances, then we can see, okay, so this pressure is normal, but before, when you were having the sciatica or the SI joint pain or the low back or whatever it may have been, that was a byproduct of the pelvis being out of balance.
Yeah, and we use the term normal because it's just something that we're used to. So like, oh yes, I'm in my second trimester or third trimester, so of course I have this back pain, it's normal. It's very common.
Yeah.
And I would say it is normal in the sense that it's your body communicating with you that something is not right. So you shouldn't have that pain in pregnancy. I've had 2 pregnancies. The only 2 times I was in pain, once each pregnancy, I did something really stupid. The first time
moving a box with your
we
foot.
Moved. Don't move when you're
don't
pregnant.
Don't ever move laterally.
Everyone
with
moves
your
when
foot
they're
out.
pregnant, like moves where they live. So I did that. And yeah, I was just doing something stupid. I tried to move a really heavy box, just a little scooted over with my foot, and my pubic joint was like, that was not a good idea. So the pain that I experienced was normal because it was my body communicating something is out and it's causing stress. Now, if I had continued and just said, well, this is where I am in pregnancy now, that would not be normal. It would be very common for women to do that, but that's your body communicating, and so it doesn't have to continue that way. Like you said, when everything is balanced and moving the way that it should, then your body shouldn't be sending you those warning signs that something's off,
Right.
which often translate as pain. Because of the changes that your body goes through during pregnancy, even in the first trimester with the relaxin hormone, things start to shift. We don't have a big bump yet, but your body knows it's coming. And so those changes happen. Whether or not we have pain, those changes are happening, and the Webster technique supports those changes. So it is very helpful for pain relief, but more than that, and what's more important to us, is that you are supported during this pregnancy and even in preparation for labor, birth, and postpartum, that recovery time.
So as a postpartum woman, I will defer to you.
Oh, thank you. I am.
I mean, I would have things to say as a I don't know, what would you refer to
You're
me
also
as?
postpartum.
I
Your
guess
body is not postpartum, but,
Yeah.
but you are postpartum.
We're in the postpartum
Yeah,
period.
Yes, yes we are. So our body goes through a lot of changes in pregnancy, and then postpartum, we used to have this weight in the belly, now it's in our arms. We're in this flexed position, however you're feeding, breast, bottle.
Leaning back over this a lot.
Where everything in motherhood is flexion, changing diapers. You're sleeping in these funky positions and you don't even know it until you wake up and there's a crick in your neck. And then your body is adjusting to these changes that occurred over the last year, really. So postpartum chiropractic care just helps support your body through those changes as well. We tend to see more tension in the upper neck and shoulders, but the pelvis is still trying to figure out what just happened. Regardless of the way your baby was born, whether it was a vaginal birth or a surgical birth, your pelvis still went through all those changes in pregnancy alone. And then postpartum, we tend to not have the greatest posture. And so when things are out like that, it can cause pain. And it's really common once you become a mom that this little bundle of joy is your focus, which they are very important, but so are you. And so we are trying to, as much as possible, communicate with moms. You matter, you're very important, and you can't take care of your baby well unless you are taken care of. You can take care of your baby, and women are amazing and just figure it out, but the quality of care that you're able to provide and just the relationship with your baby, with your significant other, is going to be better when you are taken care of and you are supported. And so chiropractic is one way to do that. We've set up our clinic as a safe space for mom. We have a feeding room and we've got couches in there and Netflix set up, and it's very common for that to be the first outing for moms. And so they come, we check on mom, we check on baby, and then they're able to go, and just sometimes a couple hours later, oh, you're still here, which is amazing. That's what I wanted. And they're in there connecting with other moms, and that is so important, that as a mother, you are taken care of in pregnancy, yes, but postpartum. And if you've had a baby, you're postpartum. So it doesn't end after 6 weeks, after 12 weeks. It's moms need to continually be supported and taken care of.
And that's why you have your postpartum PJ party too.
Yes, yeah. So
as a segue.
Oh, sure. Well, that was something that after my first baby was born, I realized I didn't really know where to go to get that support. And I kind of conned some of my patients into being my friends. And so I've now, once a month, I have a postpartum PJ party, which all that means is you don't have to get dressed. You don't have to shower. Just bring your baby. It's for babies, moms with babies under a year. And we just hang out. Usually I have a massage therapist that comes. So we have some protein bites we nibble on. And sometimes we talk about important mother things, and sometimes we talk about nothing, and it's just a safe space to get together with other moms and have that community, because we're not supposed to do this alone, and for some reason we think we are, and we try, and it's impossible. It is impossible. So we recommend babies be checked after birth as well. Both of our babies were checked within
45 minutes or an hour.
Within an hour of their births.
Which is convenient to have a chiropractor at your birth.
It is. It's a little upside. We were both at their births, and so we know what happened. They were very gentle. No one was pulling on their necks. But when we checked them, they both had in their upper neck areas where the joints were shifted, and that causes stress in the nervous system, and the nervous system controls everything else. So when we have a contraction, 12 pounds of pressure is put on the baby's head. And then when we push, it's an additional 27 pounds of pressure. And what's most effective is to push during contraction. 39 pounds of pressure.
27 and 12 is 39.
Great. 39 pounds of pressure put on their little head every time we push during contraction. So being born is hard work, and that doesn't even factor in forces for any interventions if there were forceps or a vacuum, or even with a surgical birth, that's a different kind of force put on their neck. So it's very, very, very common for things to be shifted after the birth process. So we like to check babies, and the sooner the better, because we can make small specific adjustments as they're young, so their muscles and joints don't learn this is normal, and then they come in as a 15-20-year-old and they kind of have this little head tilt, and they've been having headaches, and ideally we want to address things before they even start. But some common signs and symptoms that we see in babies that have things shifted or this stress in their nervous system is difficulty latching on one side versus another. So if the joints in the upper neck are shifted, then it won't be comfortable to turn the head equally both ways. So one way this is fine, but then this way not so much. So when we bring them to eat and they have to latch on this side, it's fine, but then when they have to turn their head to latch on the other side, that
Or you have to hold them in a different position.
Or moms were very adaptive, and so sometimes we don't even really notice that something's going on because, oh, they won't latch, so we'll just change the way we hold them because we're going to feed this baby. So if we have to change anything up with the way that they're eating from one side to another, that's usually an indicator they have that stress. Or even when you just lay them down, if they always turn their head, or they always have this cute little puppy dog
looking up at the sky
tilt. Looking up at the sky is a real common one. I've had a few babies who the mom says he just loves looking at the sky, and while I'm sure they do, we brought the head back down and the baby went back up because the skull was actually shifted during the birth process, and so that is what was comfortable for him. So feeding is usually a big indicator early on. Upset tummy, gas, colic, constipation is a big one. It's
car seat.
There's not necessarily an adjustment for constipation, but we lovingly refer to low back adjustments in babies as the number 2 adjustment, because it's very, very common. And the one reason we have changing tables in our clinic is very common after they get adjusted for their brain and body to be better connected, and it knows what to do.
Sometimes they just walk into the clinic. Well, what about car seats?
Car seats, that can be an indicator because baby's spine at birth is in a C shape, and so they should be comfortable being cradled, being even in a car seat. When they're uncomfortable being cradled or being put in a car seat, that's usually because there's a lot of tension on the backside, so it's more comfortable to arch back. And when we put them in the car seat and strap them in, not fun. So car seats aren't fun for anyone, but they shouldn't be in pain. So if you hear that cry and you're like, it's more than just, I don't want to be in this, especially from early on, that's probably a sign that they have some tension on the back side of their body causing that arching.
Yeah.
What's most important to me is that things happen in a certain order, not necessarily a timeline. Every child has their own timeline. Our first daughter was very kind in teaching us that lesson firsthand, because babies would come to me, their mom would bring them in and they hadn't taken their first steps yet, and they were 12, 13 months old, and I would check them and their pelvis would be shifted, which is really common from when they start to pull up and then they fall on their bottom a few times. So that can shift things, and then when it's stuck, they're just not able to have full range of motion, and it makes it more challenging to walk. So I've had a lot of babies who we adjust their pelvis and then they go home and take their first steps. Our daughter didn't do that. She's been adjusted since birth, and
16, 17 months.
She was 17 months.
But she was moving well. So her movement
She's
patterns
crawling
were,
everything.
Yeah.
So she was just that great personal experience reminder that their timeline is their own. But we want things to happen in a certain order. And so I had a baby recently who is almost a year, and she hasn't walked yet, but she also hasn't crawled or rolled over. And she's trying to sit up. And so those things are not in order. We need to be rolling before we're sitting. So every time she was on her tummy, she would just scream. So after her first adjustment, she was able to lay on her tummy, and then she was up on all fours, and now she's rocking. Let's see, I just saw her. She's crawling now. So we're very crawling and pulling up. We're very close to walking. And it's just things were shifted in her body. There was just some imbalance, and so it was uncomfortable. She wanted to do those things, but it was uncomfortable. And then we had another one who hadn't walked until she came in, and we got her. It was the same thing in the pelvis.
Yeah.
Those pelvises. Some rotation in the pelvis, and we got her adjusted. And after her first adjustment, she started walking.
So a common question that we get also is, do you see regular people? And I guess by regular people, they're asking, do we see non-pregnant, non-babies? So
do
like
you have
other
to be
adults,
pregnant
so
or
dads,
in a diaper?
So dads, so I do see a lot of dads as well, and kind of as a personal story, so after our first was born, it's just kind of a crazy time. And so I probably wasn't getting adjusted as much as I should have
your
been.
chiropractor was kind of on maternity leave.
Right. And there's a lot of different movement patterns that you do as a parent that you don't do if you're not a parent. And so generally, if I wasn't a parent, I wouldn't be sitting on the floor. I wouldn't have my daughter jump up and down on me. Things such as that, like leaning over a crib. Those movement patterns aren't kind of like normal things that you would do if you're not a parent. And so I probably wasn't using the best biomechanics, kind of how I was moving. My favorite is doing the jackknife sit-up, getting out of bed. So kind of like the rearing back and then propelling yourself forward.
No one should do that.
Yes, you should really roll to your side and then push yourself up, which I practice daily now. So I threw my back out probably 4 months or so after, maybe 6 months after Zoe was born.
It was probably 4.
Yeah, about 4 months after Zoe was born, and it was just kind of a wake-up call. It's like, hey, I need to move better too, but also the importance of the regular adjustments to make sure that my body is functioning the best that it can. And you really want your body to function well when you have kids.
Yes.
Just not only for yourself, but just so you can better take care of your family. And
for your relationship with your spouse, you don't want to be the one that is not feeling well when your wife is postpartum.
Yeah, it's not great to have to lay in bed all day when your wife has to take care of your baby.
She wants one baby at a time, the cute one she birthed.
Right, and yes. So we do take care of regular people as well. But I mean, we have grandma and grandpas that come in also, and people who've never had kids, and college students. I mean, we take care of a variety of everyone. So yeah, everyone needs chiropractic, not just, I mean, definitely through pregnancy and for the postpartum period.
Our additional training and education is in that prenatal postpartum period, and with babies.
Yeah.
But
a lot of that
our
information
heart is in families.
But kind of like you were saying with the pelvis, all the information that we learned in Webster really translates to everyone. I mean, it's not just a prenatal adjustment technique. It was designed for that.
Balance.
Yeah. Yeah, so I don't have round ligaments as a guy, but the rest of the components of the Webster we're able to check, and we generally, depending on what's going on, are checking everyone for that.
Yeah.
So
we're often asked what an adjustment looks like in babies and in pregnancy. Babies are not just miniature adults, and pregnant women aren't exactly like they were before pregnancy. There's a lot of hormones that are acting on the body, a lot of changes that happen, so a lot of special consideration needs to take place in both populations. So in babies, the amount of pressure that it takes to make an adjustment is about 6 ounces, which is how much you would use to check a tomato to see if it's ripe. So I use my fingertips. If they're asleep, it's very common for them to just sleep through the adjustment. Once they get a little more active and they're wiggling around, I wiggle around with them. So it's real gentle, and with toddlers, we like to have fun. We have a little lion table. The table has a lion face on it. So we lay down on the lion table, and sometimes I'm on the floor with them. Just wherever they need to be adjusted is where they will be adjusted. We don't make our pregnant moms lay on the floor. We actually have a pillow to support the belly, so they lay on their stomach without extra pressure on the baby. Which feels really great when you haven't been on your stomach for a while. And then the adjustments that we do are very gentle and specific on the mamas.
and safe for baby too during pregnancy.
Yeah, we never, so as chiropractors, we are not adjusting the baby in utero. It's really common for moms to come in because baby is in a breech position, which means instead of being head down, which is the most optimal position for a vaginal birth, they are sitting with their head up here and their bum down. So as chiropractors, we don't actually turn them, but with the Webster technique, when we make sure that the pelvis is balanced, it's very common that they have the space that they need, and then they turn head down on their own.
Yeah, they move a lot too.
They do move a lot, especially when we look at the round ligaments. Get to see like a little dance party from the babies.
I like to feel like they're high-fiving me.
Yeah. We are located in Edmond, Oklahoma, and we take care of families from all over. But we are not the chiropractor for everyone. What's most important to us is that you find someone who is properly trained and who you connect with. One great thing about both of us being in the office is if I'm with a patient and they need different work, something that he has training in that I don't, or it's just not a great connection between the two of us, we are able to refer back to each other for what that patient needs. And it doesn't ever hurt our feelings if they need to see a different doctor, whether it be one of us or even someone outside of our clinic. So we often use the ICPA directory, so that's the International Chiropractic Pediatric Association. That is who the Webster certification is through. So any doctor that is listed on their site has additional training. They have a special interest in families. So ICPA4kids.org, and you can search zip code and find chiropractors in your area who have the Webster certification or have additional training to take care of families.
There'll be a link provided at the bottom here for you.
There actually will be.
That's why I said that.
This?
ICPA 4 kids.